Why are some patients unhappy after successful cataract surgery? Today we're going to be covering this topic in complete depth. Cataract surgery is one of the most successful operations in all of medicine. Millions of people have it every year, and most of them do very well indeed. But every so often, I meet someone who tells me something quite strange. The surgery went very well, but I'm not happy. I'm not as happy as I thought I would be. Today I want to explain why this happens, and more importantly, how you can avoid being one of those people. Because the best cataract surgery isn't just about what I do in the operating theatre. It's about what you understand before you ever lie down on an operating table. So firstly, let's consider what success really means. Let's start with an honest question. What does successful cataract surgery really mean? From a surgeon's point of view, success means that the lens is perfectly positioned, well centered, the eye is healthy, and the vision on the chart looks good. But most patients don't live their lives on an eye chart. They measure success by how their vision feels when they're driving at night, reading a menu, looking at their phone, or recognizing a face across a room. And sometimes these two definitions don't line up perfectly. There can be an expectation gap, and one of the biggest reasons people feel disappointed after surgery is something I call this expectation gap. Many people quietly hope cataract surgery will give them the eyes they had at the age of 20. But cataract surgery doesn't turn back time. It does replace a cloudy lens, but it doesn't stop the eye from being a living, aging, changing organ. Some people will still need glasses for certain tasks. Some will notice small imperfections. Some will realize that better doesn't always mean perfect. And none of that means that the surgery has failed. It just means that the reality hasn't quite matched up to the picture the patient had in their head before the operation. Let's talk about the ocular surface and dry eye, because this is a very common problem as well. So here's something that most people are never really told before surgery. Your vision isn't just about what's inside your eye, it's also about what's going on the surface of the eye. The tear film, the microscopic layer of moisture, is actually one of the most powerful lenses in your visual system. If that ocular surface is dry or irregular, your vision can fluctuate, it can feel blurry, uncomfortable, or not as crisp, even if the surgery itself was perfect. Cataract surgery can sometimes unmask dry eye that was already there, or make it temporarily worse. So a patient may be told your vision is 20/20, but they don't feel like their vision is really 20/20. And that disconnect can be frustrating. Another part of vision we don't talk about enough is the brain. When we put a new lens in the eye, the brain has to learn to adapt to it. For some people, that happens in days, but for others, it can take weeks or even months. This is especially true if you choose a lens that can give you both near and distance vision, and if you've had eyes set up to work differently from each other. I often tell patients it's like getting a new pair of glasses that your brain hasn't learned how to look through yet. The eyes may be ready before the brain is. Some people also notice things like halos around lights, or glare at night, or starbursts when driving in the dark. These aren't really complications, they're just trade-offs. Certain lens designs give patients more freedom from glasses, but in return, some people notice more visual effects in low light conditions. The key isn't whether these things can happen. The key is whether you knew about them before the surgery and you decided with full knowledge about the pros and the cons of this lens choice. Another thing that's very important to talk about is the human side of cataract surgery. This aspect doesn't show up on scans or a vision chart, but surgery is an emotional event in people's lives, and it's a very large emotional event. Some people attach big hopes to it about independence, confidence, or even how they feel about getting older. And sometimes, when those deeper hopes aren't met, the disappointment gets projected onto the eyes. It's not that the patients themselves are unhappy with their vision, but they're unhappy that life didn't change the way they imagined it might be. So what can you do if you're considering cataract surgery? Well, I would highly recommend that you ask questions. Will I still need glasses after my surgery, and what will I need the glasses for? What trade-offs come with this lens option? How will this affect my night driving, screen use, or reading? Secondly, make sure the ocular surface is healthy before surgery, so it can be as healthy as possible after surgery. And finally, be very clear about your lifestyle in discussions with your surgeon. The best lens for you may not be the most advanced one. It may just be the one that fits best with the way you actually live. So cataract surgery really is one of the great success stories of modern medicine. But the happiest patients aren't just the ones who've had great surgery. They're the ones who have understood what great surgery can and can't do. If you're considering cataract surgery, take your time, learn, ask, think about your options. Because when skill meets understanding, that's when the best outcomes truly happen. Thank you for watching.